temperature is 98.2. Put this on your finger. Blood pressure is 130/79. Heart rate is 69. But first I'm going to look at your skin, hair, and nails. So we're going to look at color, symmetry, and how your skin feels, whether you're warm and dry. Okay?
Sounds good.
So you have a normal skin color. You're warm, pink, and dry. Normal skin temperature means you're well hydrated. Alright, I don't see any lesions, cuts, scrapes. You do have a couple scars. There's one here, a little one down here. Nail beds are neatly cut, clean. Can you do this for me? So there's no clubbing. Hair is dark brown black with a little bit of gray. Soft textures, not coarse. Do you have any problems with your hair thinning, or you feel like
Nope.
you're going bald anywhere?
Nope.
Okay, normal male distribution pattern of hair with the face and the jaw. You smile, thank you. Okay, well groomed. So, emotional status, he seems emotionally stable, no signs of depression or anxiety. Normal thought processes, he's able to communicate effectively with me. He's got a good attention span. His voice, he has a good quality. He doesn't speak too fast or too slow or too loud or too soft. He articulates his words. He's able to comprehend what I say to him, and doesn't seem to be any kind of perceptual disorders. His temperature was 98.2, pulse was 69, respiratory rate was 16, blood pressure was 130/79. His height is 5'6", and his weight was 180. Okay, so now we're going to look at ear, nose, and throat. I'm just going to first look and touch, and then I'll look inside your ear. Okay? Ear is warm to touch. It's pink. It's got a bit of dry skin, some moles. No lesions, cuts, abrasions. A little bit of earwax in the external canal. Couple moles on these ears. No lesions, cuts. Also a little bit of wax in the external canal, a little bit of hair in this ear. I'd like for you to look slightly away, please. And I'm just going to look inside your... See a little bit of earwax, some hair. Tympanic membrane is pearly gray, concave. No redness, no foreign bodies. Very good.
Okay.
I'm going to check the other ear. Look slightly away again. Also a little bit of hair, some earwax. Ear canal is a bit red. Tympanic membrane is pearly gray. So I wasn't able to see the handle of the malleus, the short process of the malleus, the pars flaccida or pars tensa. Now we're going to check for cranial nerve 8, which is the Weber test. So I'm going to strike this and put it on top of your head. I want you to tell me if you can hear it on both sides. Hear it on right and left?
Mm-hmm.
Okay. And then we're also going to do the Rhine test. Alright, so I'm going to strike this on my hand. I'm going to put it behind your ear. I'm going to need you to tell me when you stop hearing it.
Okay.
Okay? We're testing bone conduction.
Okay.
Can you hear that?
Yes.
Okay. We're going to do the other side. Same thing.
Okay. I can't hear it. Stop.
Okay, very good. All right, so now I'm just going to look at your nose, mouth, lips, and throat. Okay, so turn this way just a bit. His nose is deviated slightly to the left, just like maybe a 10-degree angle. Any trauma? Did you ever break the nose?
No.
Anything like that? Do you have trouble sleeping at night, snoring?
I snore a little.
Okay, do you have nosebleeds, any kind of drainage coming from your
No.
nose? Tilt your head back for me. I'm just going to look inside. Okay, no drainage, no signs of trauma, no bleeding, does have some nose hair. The turbinates looked pink. They look normal. There's seems to be no sign of trauma or scratches. His lips are moist and pink. They don't appear to be dry or cracked. No lesions, no cuts, no abrasions. Open your mouth, please. Inside of his mouth, mucous membranes are pink. He has all of his teeth bite down. A normal bite. Do you have problems chewing or eating?
No.
Okay, I'm gonna stick out your lip a little bit. Got a couple bite marks on his lip. You see the top? Still pink and moist. Stick out your tongue. Tongue is pink. Say ah. The uvula is pink. There's no redness in the tonsils. They're visible. Stick your tongue up. Frenulum is good. No lesions. No bumps. The buccal walls look normal. There's a bite mark. Looks like he's bitten his jaw. Normal mouth. Lips are symmetrical. Can you smile? Smile is symmetrical. Teeth look like they've been well taken care of. No malodor. Teeth are spaced closely together. He appears to have all of his teeth. Didn't see any signs of cavities. No signs of gum bleeding, hyperplasia, inflammation, lesions, or edema. Tongue is nice and pink. Frenulum is pink as well. It's small. No deviation, no twitching, no restricted protrusion. I could not see all the way down to the salivary glands, but the buccal cavity was pink. I did not see any signs of tumor or lesion, trauma. The floor of the mouth looked normal. He had a normal palate. The uvula was normal, pink, was not inflamed, was not reddened. Tonsils were also normal, not inflamed or reddened. Okay, now I'm just going to look at your head and neck. His head is symmetrical, normal shape, normal cranium, doesn't appear to have a flattened skull in the back or any major deformities. Face is symmetrical, appropriate size and shape. Can you wiggle your eyebrows up and down for me? Okay, close your eyes and squint really hard. Relax. Smile. Okay, very good. So he has symmetrical movement throughout his face. I'm just going to touch your sinuses, okay? Do you have any tenderness at all?
Nope.
Okay, very good. Scalp appears symmetrical, clean, no evidence of any kind of lice or lesions, well groomed. No tenderness lesions. Okay, now I'd like for you to take one hand and
Mhm.
close off one side of your nose and close your eyes. And then tell me what you smell.
Smells like vodka. Alcohol.
Okay? Again.
Vanilla.
Okay, very good. Now, same thing with the other nose.
Vanilla.
Okay? And again.
Alcohol.
Okay, very good. So now we're going to test for cranial nerve 5. Can you please take your glasses off? Okay, I'd like for you to look up and away. Okay, look at me and look up and away. Don't turn your head. So both eyes blink when I touch the cotton swab to the corner of his eye. Did you feel it on both sides?
Yes.
Okay. So I would like for you to close your eyes again. I want you to tell me if you can feel if I touch you.
Mhm.
Okay?
Mhm.
Did you feel
Yes.
that? What did it feel like?
It felt like a blunt object in the middle of my forehead.
Was it sharp or dull?
I thought it was dull.
Sharp or dull?
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Very good. Okay, I need you to, oh, you can open your eyes. Open your mouth wide. Now clench your jaw. Very good. Keep your jaw clenched. Okay. Masseter muscle. Now I'm just going to look at your neck and feel your trachea and your thyroid.
Okay.
Okay, you can put your glasses on. Alright. Just going to feel the trachea. Thank you for tilting your head back. Trachea feels normal. Okay, here's a cup of water. I'm going to feel your thyroid. I'm going
Okay.
to ask you to take a sip of water and swallow it. Please take a sip of water and swallow it. Tilt your head back just a little. Wait, can you put that in the other hand, please? Okay. Okay, swallow. Okay, can you do it again, please? Swallow. Okay, very good. Trachea felt normal. I felt it move a little bit. I didn't feel any masses, lumps, bumps, anything like that. Carotid arteries look good. Don't see any bulging, no lumps, bumps. And now I'm just going to feel your lymph nodes.
Okay.
Okay? Anything painful, sore,
Nope.
tender?
Nope.
Anything?
Nothing.
Okay. Okay, now we're just going to look at your eyes. So can you please take your glasses off for a minute? Okay, I need you to look far to the left and far to the right. Okay, no strabismus, no nystagmus. I'm going to look at your tear ducts, okay? Okay, so the tear ducts look patent. Conjunctiva is pink, moist. Didn't see any evidence of a sty or any obstruction, any irritation. The sclera of the eye is white. You can see a few blood vessels. The color of his eyes are hazel. Pupils look about 3 millimeters in diameter. So now I'm gonna turn out the lights and I'm gonna look at your pupils and your optic nerve and everything else. So I wanted you to be able to watch my technique when I use the ophthalmoscope. So I turn the light on outside but close the door a bit so you could kind of see what I'm doing, but I could also examine him appropriately. Can you take your glasses off again, please? I'm going to put my thumb on your eyebrow, put your head back and look straight ahead. So I see the optic nerve and the branches. Positive red reflex. Take a break. I'm going to look at the other eye, okay? Put my thumb on your eyebrow. Positive red reflex. Optic nerve. Several other branches. So I was able to see the optic nerve, the arterioles and venules, positive red reflex, and no papilledema. Put your glasses back on. The optic nerve looks well demarcated, clear, with no blurring, no papilledema. It had a positive red reflex. I was able to trace some arterioles and venules as well. Put your glasses back. So now we're going to check for visual acuity. Here's our smell and eye chart. My patient is 20 feet away, and I'm going to have him start at the top, at the big E, and work his way down, and we'll see what his vision is. Take off your glasses, please. Okay, I'm going to stand behind you. Okay.
I can't see what the first biggest letter is.
Oh no.
That's right.
Okay, put your glasses on.
Gosh, I'm so bad.
Okay, now read.
Oh, top line? What do you want me to
Start at the top line and work your way down as far as you can go.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, and then it gets difficult, F, D, F, L, T, E, E, D?
Okay, very good. Okay, very good. The farthest line that you could see down with the glasses and corrected vision was 2015. So cover your right eye and start at the, there you go, and start at the third line down and read right to left.
Z, O, T, C, D, P, D, E, P, L, D, F, C, E, P, P, Z, C, F, D, E, D, Z, P, O, L, E, F, C, E, T, O, P, F, E, D, T, O, P, D, O, F, E, L. I cannot see it, but I think it's O, E, C, T, L, F, E, F.
Okay. Now cover your left eye. And same thing, start the third line down, read left to right. So both your right eye and your left eye were also 2015 vision with corrective lenses. Very good. So this is to check your near vision. I need you to hold this down and start at the top line, read all the way across with your left eye covered.
E, O, P, Z, T, L, C, D, F, T, D, P, C, F, Z, O, E, L, D, Z, E, L, C, F, O, F, P, O, L, E, O, D, P, F, C, T, L, E.
All right, very good. So your near vision was perfect. You read every line correctly. Good job.
Thank you.
I want you to look at the pencil, look straight ahead. Now look back at the pencil. Okay, his eyes constrict appropriately. I would like for you to follow the pencil with your eyes. Don't move your head. All 6 muscles appear to work well. There was no deviation, no slanting or weak muscles that I could see. I'm just going to check your peripheral vision. When you see my finger, say now.
Okay. Now. Now. Now.
Okay, very good. Peripheral vision seems to be intact.